From Denver 7, this is 7 News.
What doctors are saying parents and children should look out for.
Plus, new technology that could cut how long you keep your braces on for that perfect smile. Welcome back to 7 News this morning. Wearing braces is almost a rite of passage in our society, and now, thanks to new technology, treatment that could take as long as 4 years can now be done more quickly.
I like the sound of that. New treatment techniques are also making orthodontia available to adults. Joining us now to explain what's new in the orthodontist office is Dr. Straffon. Thanks for joining us this morning, early this morning. We appreciate it. Well, tell us about this new technology out there.
Well, thank you very much for having me down this morning. And it's truly amazing the advances that we're seeing in orthodontics today. Specifically at our office, we're using the Damon system. The Damon system allows us to be able to not only see significantly improved treatment results, we're seeing these in major reduction in treatment time. In fact, almost 3 to 6 months of reduced treatment time. We're also seeing these improvements with far fewer appointments needed by the patients. Our intervals of appointments are between 2 to 2.5 months. That's a major extension compared to what we used to see even just a few years ago.
Sure.
I think a lot of times people always complain about the discomfort of braces, especially in the beginning. So are the effects the same, the side effects, if you will, or is it different with this new technology?
That's a wonderful question. The aspect of technology today, the difference is in traditional style braces, or what we've used for many years very successfully, is that we used to have a simple elastic tie that would go around. This is an example of a model of a brace that we can use as a demonstration. And the elastic tie goes around the outside of the brace itself. That actually tightens the wire to the tooth in which the brace is adhered to. In the process of that creates a friction base. So if you try to move the actual model itself, it creates a friction process, and it reduces the ability to move teeth quickly. If you actually remove the elastic tie, which is what enhances the advance of the Damon system, is it reduces that friction that's there. And so the wire can slide much more gently. So there's a major reduction in discomfort, there's no tightening with the braces themselves, and it's really a major improvement with how we're able to move teeth much more gently in what we consider as orthodontics biologically sound principles.
So as a result of that, are you finding more adults are now saying, you know, I needed them before, I'll try it now because it's less time and it's more comfortable?
Absolutely. In fact, some of the patients that we see, we're seeing an increase in the demand of patients in our practice as we're continuing to see patients demand and recognize. Research shows us today that self-confidence and self-awareness with improvement, those are things that are major attractions for adults today, and we know the economy and what's happening, and this makes a major difference with what we're able to do for them as they are making investments into themselves, which is really wonderful.
Good. And for those who are interested out there, I'm sure there are a lot of people, how much are we talking about? Is there a big cost difference for this? Or?
Well, the cost is based on the complexity of the treatment case, and so that's always variable, and it's very difficult to just be able to say. It's something where we would prefer to have somebody come into the office and be seen by truly a trained orthodontist. That's very important. In the advent of being able to have that at our office at Straffon Orthodontics, we have complimentary examinations, and what that allows us to be able to do is to spend time with each individual case and share with them what the cost of treatment is. With the economy today, what we've also done is we've made major changes in how we allow and help patients get through some of these economic difficult times.
And since it's fairly new, is it covered by insurance?
You know, in orthodontics itself, just so people understand, there's usually a small portion of the overall fee that's covered by orthodontics. It's not like going into the medical office where each visit you have a certain portion paid for. In that, most people do have a benefit of insurance that is applied to them in the treatment costs. But what we have made is major arrangements where we can make flexible payments so that people can either reduce what they would consider as a down payment or even a monthly payment to make it so that it works. And it's very affordable for people today.
So,
Okay, go ahead.
No, go ahead.
How's this, though? So can you give us a range of costs then, at least? You know, is it comparable to the traditional techniques compared to this new one?
Well, I think, you know, for people to understand, a range of braces today can, and it's all dependent on the quality of the person that you're going to go see. To nail down a price, it's very difficult to do, but I think that, you know, average person for comprehensive treatment is probably between $5,000 to $7,000. It really depends on truly the complexity of the case and what's really applied to that. And I think that that's really important for people to recognize that going around and shopping for different costs, it's not like going out and buying a car. You're buying an investment investment into yourself, and you want to make sure that you're seeing somebody who's qualified and also someone who's actually going to provide you with the best overall investment of that smile. You want to create a smile for a lifetime. It's really important.
Very good. Well, thank you for coming in, Dr. Strand. We appreciate it.
It's a pleasure. Thank you very much for having me.
All right. We do have more information for you. If you'd like to find out, just go to our website. That's denverchannel.com. Click on the big red TV button. We'll have more information there.